to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision and only your decision on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor show. For September is Atrial Fibrillation Month, also known as AFib for the common term. And we're so lucky to have on the program busy time of the year for cardiologists and cardiothoracic surgeons as well, just to have one on to talk about AFib, which is becoming a very important topic. Because it can lead to stroke and other ailments. We have Dr. Neil Galindez. He's a cardiothoracic surgeon at Florida Medical Center in Fort Lauderdale. He's also on staff at Delray Medical Center, great hospital, both great hospitals, and Palm Beach Gardens Medical Center as well. Dr. Galindez, welcome back to the program. How are you doing this evening?
Thank you, David. Thank you for inviting me again.
Thank you. I know you've been so busy with so many media placements lately. We've seen you all over the news and also very busy in the OR as well, and wanted to have you on because, again, September is a good time to think about atrial fibrillation, whether it's, you individual or a family member has some kind of tick with the heart or heart arrhythmia. You definitely got to see a primary care physician, and if it goes farther than that, a cardiologist or surgeon. So without further ado, Dr. Galindez, can you tell us what is atrial fibrillation or AFib? Because just a few years ago, I had never even heard of the term, to be honest with you.
Well, you're right. It is the month where we need to, we're making a lot of awareness for atrial fibrillation. But it's such a common problem and such a big problem that we should be aware of what to do if you're diagnosed with atrial fibrillation every single month, right? So let me just start with telling you that atrial fibrillation is so common that it's estimated that about probably 3 million people have atrial fibrillation in the U.S., and it's estimated that in the next 10 or 20 years, that number is going to double. And it's important because someone that is diagnosed with atrial fibrillation has a 5-fold increased risk of having a stroke. And we'll talk about why is this. Also, it has a 3-fold increased risk of developing over time heart failure, which is a diminishing function of the heart and strength of the heart. So it is very important to know for your audience to see if they have any atrial fibrillation, know what the risk factors are, know what symptoms to expect, and what to do once they're diagnosed. So your first question was, what is atrial fibrillation? The heart has an electrical system. It has very specialized cells in the muscle, embedded in the muscle, that generate a electrical impulse, and then this impulse travels through normal pathways throughout the muscle of the heart, from the top of the heart to the bottom of the heart, to create a heart contraction. Atrial fibrillation occurs when, for whatever reason, there's something happens to the muscle on the top of the heart, in the atria, the chambers of the heart, and this muscle creates fibrous tissue or scar tissue. When this happens, then many areas of that muscle will start firing abnormal electrical impulses, some at the same time, some at different times. So the whole electrical activity is not coordinated anymore, and as a result, you're going to have a quivering of the muscle instead of a contraction of the muscle, and the blood then is not going to be squeezed down to the bottom side of the heart to be squeezed out of the body as it regularly is, and that's atrial fibrillation.
That is a fascinating explanation, Dr. Galindez. Now, are there symptoms that are different? You've seen a lot of patients being a cardiothoracic surgeon. Are there symptoms that are different for men and women? Because I've actually interviewed a woman once who said it felt like I had a bird fluttering in my chest, and then I've interviewed a man before, and he said, I didn't even know I had anything. My primary care told me. Does it differ from man to woman at all?
That's such an interesting question, because we know that there's certain symptoms for certain cardiac diseases, like a coronary artery disease, and if you're having chest pain or you're having symptoms of a heart attack, certain symptoms can be a little different or slightly different for men and women. But for atrial fibrillation, it's less common. Atrial fibrillation has a set of some people have no symptoms at all, completely asymptomatic. They can have atrial fibrillation. Their heart could be on atrial fibrillation without them feeling it, and that's such a dangerous thing, because then if they haven't been diagnosed, they end up going to the hospital with their first stroke, and that's where they find that they have atrial fibrillation. So the symptoms go from completely absence of symptoms to developing fatigue over time, developing signs and symptoms for heart failure would be walking and getting short of breath, dizziness, sometimes fainting. Some people use, you mentioned this bird fluttering in the chest. Some people feel what we call palpitations in the chest, like a fish moving inside. Some people say that can hear and can feel their heart actually pounding or fluttering inside the chest, or racing inside the chest. So those are some of the symptoms that people can have, and if the heart starts conducting some of those abnormal electrical impulses very fast to the bottom of the heart, to the ventricles, then the ventricles are going to start beating really, really fast, and it could go from, your normal heart rate should be less than 100, but about 60. But patients with atrial fibrillation can have episodes where these impulses are traveling so fast to the rest of the heart that can have heart rates of about 130, 140, up to the 200s. Just imagine your heart pumping that fast. What's going to happen is that because there's not enough time for the heart to relax between each contraction, because the heart is pumping very fast, right? So if it doesn't have time to relax between each contraction, it's not going to be filling in with blood enough for the next contraction to occur. So when the next contraction comes, the heart's still not filled with blood. It contracts, so a smaller amount of blood is ejected from the heart to the rest of the body, and that's very dangerous, because if you have less blood flowing through your body, you're going to have less blood flowing through every single organ, including your brain.
Yeah, we know from having so many doctors on the program that's bad news when the blood doesn't flow at the rate it should. I just want to give out Dr. Galindez's info. I'm so happy that he had a chance to join us because it is Atrial Fibrillation Awareness Month. But like you said, anytime is the time to know about AFib. It's Dr. Neil Galindez. He's a cardiothoracic surgeon. His office is at 3001 Northwest 49th Avenue, Suite 104, Lauderdale Lakes, Florida. That's right in front of Florida Medical Center. That is Dr. Galindez's main office. He's bilingual, English and Spanish, so that is very helpful here in South Florida as well, so you can connect with a huge patient base, and very dedicated surgeon, also on staff at Delray Medical Center and Palm Beach Gardens Medical Center, where I was actually born 41 years ago. So I always think that's awesome that he's there as well. And that's a great heart hospital. All three are great heart hospitals: Palm Beach Gardens Medical Center, Delray Medical Center, and Florida Medical Center. And Dr. Galindez's number is 954-714-0686. We'll give out that info again. And website, ton of info. You can see his education and training. His areas of interest is drneilgalindez.com. So drneilgalindez.com. Dr. Galindez, another reason I wanted to have you on the show is everyone knows I watch a lot of sports, and I've been seeing AFib in sports. A couple weeks ago, we had Dodgers closer Kenley Jansen. He had to miss a few games because he had an AFib episode, and I believe he had to have it treated at a hospital out west there. And we also saw it, he needed an electric shock to stabilize his heart. I'm seeing right here on August 15th. We also saw it in the Cleveland Browns NFL Hard Knocks with Devin Cajuste. Father and son bonded over the emotional Hard Knocks and AFib episode that one of them had as well. Do you see it a lot in younger people, older people? Are you seeing it more in, and it seems like it's a little more prevalent in athletes later? What is the age range for atrial fibrillation?
So that goes into the risk factors for atrial fibrillation. That's such an important thing because if you have some of these risk factors, and with symptoms, you know that you need to go see your doctor and make sure that they rolled out atrial fibrillation. But it is not as common in young people, although, as you just mentioned, some athletes have it. I think Larry Bird from the Lakers also had a history of atrial fibrillation. And what happened is that some of the atrial fibrillation, there's some genetic variants of a disease that if you're born with it because you have the gene pool from your parents, that predispose you more for atrial fibrillation. Anything that makes changes in the pressures and the composition of or the creation of scar tissue in the top of the heart will be predisposing the patient to atrial fibrillation. It could be stress. It could be just increased pressure in the atrium for some other unrelated reason. Some people will, let's say, for example, some people have sleep apnea. Problem that, when you go to sleep at night, for whatever reason, you stop breathing. When you stop breathing, then you create a lot of pressure changes through that episode of apnea, of not breathing. And with time, the blood pressure in the lung system changes. That affects the pressure in the upper chambers of the heart, especially the right atrium, because the pressure of blood is going to change there. Now, with increased pressure, there's going to be a dilation or enlarging of that chamber, and it's kind of like the muscle of the heart is kind of like the skin. If you stretch it too much, then you're gonna get stretch marks, right? So in the heart, the atrium in particular, you get this scar tissue, and once you get those changes in the muscle, then the electrical activity that it's normal and it conducts normally through that muscle in the heart is going to change and it's going to get affected and probably creating atrial fibrillation. So let me tell you about other risk factors for atrial fibrillation. Usually occurs as people get older. Okay, so one of the risk factors is if the patient is over 60 years of age, then they're more likely to have it. Things like high blood pressure, coronary artery disease are also processes that will predispose people to have atrial fibrillation. We already talked about heart failure. Heart failure could be the result of atrial fibrillation, or it could be a cause of atrial fibrillation. Heart failure makes your heart function decrease, and the pressure in the chambers will increase, creating these changes that we already talked about. Any heart valve disease, like the mitral disease, if you have something called mitral regurgitation, the mitral valve is a valve in between the upper and lower chamber of the heart on the left side. That's the mitral valve. Some patients have a leaky valve, and if the heart valves are made to allow blood to go from one chamber to the next, but not in reverse. So it's a one-way valve. If you have a leaky valve, that means that the flow or some of the volume, some of that blood goes forward and it goes backwards, and that's the part, the abnormal part. If it goes backwards, then the upper chamber of the heart, the left atrium, is going to handle an increased volume because now it has the natural volume that gets to that chamber plus the regurgitant volume from the ventricle, the leaky from the leaky part of the valve. And with more volume, the pressure goes up, and the chamber is going to enlarge, and it's going to create scar tissue again, and we go through the cycle of creating a nidus for abnormal electrical activity. Other things, prior heart surgery, or as a heart surgeon, we will know that about 1/4 to 1/3 of our patients they develop atrial fibrillation, but this atrial fibrillation is a little different because what we do throughout surgery, we saw things in the heart, so that creates on its own or itself inflammation in the heart. Inflammation, an inflammatory process in the muscle of the heart, also is a risk factor for developing atrial fibrillation. We already talked about sleep apnea, thyroid disease. If your thyroid hormone is overreacting, hyperthyroidism, it's also a predisposition factor. Other things like diabetes, lung disease, for what I mentioned before about the high pressure on the lung system, also can give you atrial fibrillation. Now, importantly, you said young people. Well, there's a lot of young people out there that abuse alcohol or stimulant drugs. When this happens, the heart is going to be stimulated to beat faster and faster and faster. The more they do it, the more episodes they have, and it's something called tachycardia, meaning just the heart beating very fast with some of these drugs. If this happens very often, you can actually change the pressures and the structure of the muscle in the heart and end up with atrial fibrillation.
Dr. Galindez, hold that thought. I'm going to see if I can still take a commercial at this point. And on the other side, I'll ask Dr. Galindez some of the treatment options he does for atrial fibrillation.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision and only your decision on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Getting older is not for sissies. That's what one of my patients says. And it's funny, but it's true. Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
And we're back with Dr. Neil Galindez. He is a cardiothoracic surgeon, Tenet Florida Physician Services. Dr. Galindez's office is at 3001 Northwest 49th Avenue, Suite 104 in Lauderdale Lakes, right in front of Florida Medical Center. He's also on staff at Delray Medical Center and Palm Beach Gardens Medical Center, three great Tenet hospitals. And I will tell you today, if you go onto Dr. Galindez's website, and this is going to be news to him, it's drneilgalindez.com. He just wrote a blog for us on atrial fibrillation that was just launched as I was on the air here. It's called Atrial Fibrillation, Getting Your Heart in Rhythm. So take the time to read that and to show your loved ones and family members, because that's Dr. Galindez's writing. He did a great job on that as well. Lucky to have him on board at Tenet Florida Physician Services. Dr. Galindez, you do a unique procedure where you work with a cardiac electrophysiologist for treatment of atrial fibrillation. Can you tell us a little bit about how, I believe it's known as the converged procedure or convergent procedure, is that correct?
That's correct. It's a convergent procedure. Let me tell you, before we talk about surgical treatments, which are very important, let me tell you how someone is diagnosed with atrial fibrillation and what to do, if you allow me to do that. When you if you have any of the risk factors that we just mentioned, and you have some of the symptoms, you go to the person has to go to the doctor and get a complete history and physical exam. During that examination, an electrocardiogram will be done. And an electrocardiogram is, when they put those little stickers on your chest, and the machine measures and traces the electrical activity that is reflected from the activity of the heart. So we kind of see the trace and see what the heart is doing. If someone is in atrial fibrillation, there's a specific pattern on that trace that we can see as atrial fibrillation. So that's step number one, a complete history and physical with an electrocardiogram. Once the patient is diagnosed with atrial fibrillation, then it's a good idea to have a deeper workup, including an echocardiogram, which is like a ultrasound of your heart. And this is just to make sure that there's nothing else there, that the function is still good in the heart, that there's no problems with any of the valves of the heart. As I already mentioned, some of the most common things that we see with atrial fibrillation would be mitral regurgitation. Okay, so if the patient still has symptoms and they feel these palpitations in the chest, sweating, dizziness that comes on and off for no reason, but the EKG or the electrocardiogram shows nothing other than a normal rhythm, there are mobile devices that can be worn by the patient to monitor the heart for a longer time. This could be a Holter monitor that is good for a few days, and what the Holter monitor does is monitors the electrical activity of the heart for more than 24 hours. There's other devices that can be actually implanted under the skin. These are loop recorders. Okay, these are very specialized and sensible devices that are implanted under the skin and that can detect that electrical activity, and that can be worn for several weeks. So patients with atrial fibrillation usually develop short episodes of atrial fibrillation, and then they go back into the normal rhythm. So sometimes it's hard to catch them when they are having one of those episodes on the electrocardiogram. The electrocardiogram only gives you a few seconds of the trace versus the Holter monitor, which is days, or the loop recorder that it's a month. So now, you asked me about the treatments for atrial fibrillation. First of all, as we mentioned at the beginning, atrial fibrillation predisposes you for having a stroke. So probably all patients, and this is based on their factor for having a stroke, the risk factor for having a stroke, probably all patients should be on some sort of anticoagulation or a blood thinner to prevent a blood clot from happening. Why does this happen? Because in atrial fibrillation, the atria are quivering instead of contracting, and the blood gets stagnant. And sometimes there's a special part on the left side of the heart, on the left atrium, called the left atrial appendage. That little sac is part of the atria, and if this little sac also is quivering instead of contracting, then blood gets stagnant there, and little clots can form, and those clots can go out of the circulation, the natural route, go to your brain and give you stroke. So that's so important to know that you have atrial fibrillation for the patient to get evaluated and see if they need anticoagulation to decrease the risk of stroke. So for the treatments, you just mentioned something about shocking someone back into rhythm. One of the things that we can do is...
We got just about a minute left, Dr. Galindez. Just want to update you.
Excellent. So what we can do is actually use electricity to shock you back into the normal rhythm. And there's things that we can do as surgeons, working with electrophysiologists, working together to do a special kind of ablation, a procedure to stop the electrical activity, which is abnormal. And for that, I work with an electrophysiologist. I do it from the outside of the heart. The electrophysiologist does it from the inside, giving a better ablation and giving better results to get someone to sinus rhythm, David.
Dr. Galindez, I want to thank you again. It's drneilgalindez.com. Join us on Friday at 5:30. We're back on there, How to Stay Healthy show.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. All County Healthcare, Inc. is locally